Hello everyone. So how is everybody doing today? I hope that each and every one of us is doing very well today. So I hope that we can do some social distancing, at least 1 meter away from each other, and wear your protective mask because we are still in a pandemic situation. So I really hope that everyone can cooperate with that. Before we are doing anything, before I'm going to continue with my lecture, my teaching, I want to introduce myself. So my name is Refa Asarela Jaimis. I'm Assistant Medical Officer in this Emergency and Trauma Department. I'm the student of Bachelor of Medical and Health Science in OUM, and now I'm in a May semester 2020. Microteaching is one of my assignment in teaching for healthcare personnel. So today's topic is all about a clinical procedure which actually we attend it in our daily basic life, including all of the students. If you are going inside, not in an emergency department, but also in other departments such as ward or outpatient department. Today's topic is about, I know that everyone is already clear about these topics, but I would like to remind you that this topic is very important, very essential for us because it is the basic thing that all of us should know. So my topic are the intramuscular injection, or in clinical way we could use the word of IM injection. What is intramuscular injection, everybody? Intramuscular injection are commonly used when substance is introduced into the body and will be stored in a muscle for a long period of time, allowing rapid release into the system. So basically, it is needed for a medication that is used for intramuscular only. You cannot make your own medication and put through intramuscular. That is a big no-no. The proper way is giving intramuscular injection or using the intramuscular injection medication itself through our muscular muscle. Basically, we have three routes of medication administration, which is a topical, enteral, parenteral. IM is in categorized of parenteral. Via injection, penetrate into skin layer. The time taken effect should be around 20 minutes or more. So the angle is 90 degrees. You point the skin into 90 degrees, not 45, not 10 degrees, but it should be poked at 90 degree angle. So for your information, there are certain sites of injection that you may give to the patient, which is the deltoid muscle over here, deltoid muscle, vastus lateralis and rectus femoris is actually our thighs. Dorsal gluteal and ventrogluteal is at our hip side, or we can call it as a buttock side. So how to prepare IM injection, intramuscular injection? Before, we want to know how to perform IM injection, which side is the best for IM injection, we need to know how the preparation are. So number one is follow the 11R. So what is 11R actually? You must have the right patient, the right route, the right time, the right medication, the right dose, the right documentation, the right assessment, the right evaluation, the right education, the patient rights to refuse the medication, and very important thing that you should know that the right expiry date of a medication, because for a certain medication, if the medication was expired, it may be harm to the patient, or even it doesn't do any effect to that patient. So just waste of time giving intramuscular, but the medication did not have that therapeutic effect. Okay, so number two, you must take consent from the client. Is he or she agree to be given to, or she or he agreed for that procedure to be undergo through him or through her. Make sure that thing, you must apply a personal protective equipment, PPE, apron, and then wear some gloves, and because this is very important, for anything could happen between you and the patient. A personal protective equipment should be applied whatever the situation are, whatever patient are, even the patient is clear, or you know that she or him clear from any other disease. And then prepare a injection set. So this is the injection set. These are the injection set. You have the gallipot, you have the alcohol cotton swab, forceps, kidney dish, and any other equipment are. So these are the medication that we will giving to the patient. This is the syringe. I take 3 mils, and this is for the needle for injection. The size 23G, and for the syringe out of that medication, we can use a bigger needle, which is 22G size. And then our PPE, it is the glove. So these are the medication that we are giving to the patient, that we are prescribing or administered to the patient, which are be given through IM injection. This is ATT injection. These are the syringes we open and put inside this kidney dish, 23G size of needle, and the 22G size of needle. This is how our tray set. So firstly, we are using this forceps. We will be taking this bigger needle, placing secure to the syringe. Open the cap of the syringe, of the needle, and then this is the medication. We will syringe out according to dose that should be served to the patient. So ATT will be given 0.5 mils. Clear up the bubbles. And then this needle can be thrown into sharp bin. And then taking the smaller needle, placing at the syringe, and then this needle can be served to the patient. If you want to serve the patient, you just open the cap of the needle using the forceps. And a cotton alcohol swab. Now I'm going to teach you on how to perform IM injection to a patient. So I'm going to introduce you. This is my patient. His name is Mr. John, and he is a dummy person. And this is actually the site where we are going to give the injection. So now I'm already wearing my PPE, which is the gloves. So firstly, this is a deltoid region, deltoid site. So basically, only 1 mils of medication injection given to this part of area. Beyond than that, you may consider a larger muscle, because the risk of brachial artery and radial nerve damage exists over this site. You can use this site, this place, for 4 years old, but cannot use for infant or toddler. It is located at the lateral aspect of upper arm. Over here, lateral aspect of upper arm, 1 to 2 inches below the acromion process, or by placing index finger and middle finger over the acromion process. So the injection site will be 1.5 to 2 inches below the middle finger. So over here, 2 or 1.5 inches. So the place of injection are over here, this side. Over here, or right. Good. Over here, 1.5. Sorry, must be careful with your needle. 1.5. So you just poke 90 degrees on the surface. So you poke. After you poke, you must withdraw some bubble, because you want to know if there's a blood supply, or maybe the needle are poked at the artery or the vein. So the medication cannot be given through that. So you have to pull the needle if you can see that there's a blood inside of the syringe. But if there is no, then the medication can be syringed in. Carefully, slowly, and then wait for 1 and 2 seconds. Then you can leave the needle outwards. Easy, isn't it? So next, we are going to the dorsogluteal side, which is located at our buttocks. So this is Mr. John buttocks, which I have already separated it with the body. So I'm going to show you the side of the buttocks. So it is located at the line of posterior iliac side and greater to the trochanter or femur, above and outside this line but several inches below the iliac crease. So basically it is at the buttock side, and a traditional location is giving most adult through IM. So you need to know that improper site selection can result in a damage of subsciatic nerve or injection into superior gluteal artery and vein. So it is also contraindicated for infant. So this is the iliac crease, and these are the upper outer quadrant of buttocks. So the location mostly is over here. So of course the needle, extra careful with the needle, which inside you already put a medication. 90°, you'll be poked with 90°, syringe out to see any blood. If there's no blood, you can syringe in the medication, wait for 1 to 2 seconds, and then you can take out the needle and throw in a sharp bin. Next, the third one is ventrogluteal site. Ventrogluteal site is actually referred to the site of injection at the hip area. So can be used if the client is in a side of lying, prone or supine position. So it is actually a safer and less painful compared to the dorsogluteal site. But the disadvantage of injection at this area, it can cause some anxiety, because mostly when we cannot see any injection being poked into our body, it will make you more anxious or anxiety when will the needle being poked to you. So this is the iliac crease. You can see this is the iliac crease, and if you can put your finger like this. Sorry, I'm going to hold my needle because I'm going to show you. Be careful with the needle. This is the iliac crease, and putting your finger, your index finger, to the interior superior iliac spine, and placing your palm at the greater trochanter of femur. This is the trochanter of femur, and which side, this is the location. So you can just poke into 90°, syringe out a little bit. If there's no blood, you can just syringe in the medication and then wait to 1 to 2 seconds, and then you can release the needle. So next, the fourth, 1, 2, 3, yes. So next, the fourth place or the fourth side you can give are the vastus lateralis side, and the fifth is the rectus femoris side. So vastus lateralis and rectus femoris at the same side, at the side of your thighs. So it is the thick muscle at the thigh area, and mostly can be used for children below than 3 years old. So if you can see that a lot of infant baby vaccine by vaccinate through area of their vastus lateralis and rectus femoris, or we can say that it's a tight area. Location of the vastus lateralis is by placing a palm on one over a greater trochanter over here, and the palm on other hand over the knee. Basically, they will like that. So this is the back, the thighs. and it's just between here. You can just poke 90-degree injection, cinch out a little bit. If there's no blood stain, you can just pull in the medication and wait for 1 to 2 seconds, and then you can take the syringe and throw in a sharp pin. The poke site is almost the same as the vastus lateralis. So guys, thank you for listening and attending this microteaching course, and I hope that by this intramuscular injection teaching, you have a lot more confidence in performing this procedure to a patient and can give less harm to the patient. Always remember, when doing any procedure to a patient, please wear your personal protective equipment. Well, that's all for my clinical procedure presentation. Hope you guys enjoy, and we can do activities after this. I will let each and every one of you to play with this dummy and make fun. I mean, not make fun of this dummy, but practice with the injection that I already provide, for you to polish your skill in doing intramuscular injection. Thank you.